Excited delirium is new to the law enforcement community primarily because of the rise in the use of illicit stimulant drugs and also because of the closure of many inpatient psychiatric or mental facilities. As early as 1849, it was known as Bell's Mania and used to be the domain of doctors and inpatient psychiatric clinics. That's primarily where you saw it. As these people have moved from an inpatient clinical setting out onto the street and begin self-medicating with illicit drugs, it's now becoming the first responder that has to deal with this syndrome. The current published medical definition of excited delirium is a state of extreme mental and physiological excitement characterized by extreme agitation, hyperthermia, hostility, exceptional strength, and endurance without apparent fatigue. In many circles, this is also known as in-custody death syndrome. We're not expecting officers to become diagnosticians or medics, but we do want you to be familiar with the different signs and symptoms of excited delirium as a medical crisis so that you recognize when somebody needs medical intervention. They're acting out, they're violent, it looks like it's a hardcore law enforcement problem. But the problem is we have no way of knowing where they are in this syndrome. We don't know if they've just started a binge or if they're circling the drain waiting to die. And we certainly don't want them dying in the back of your police car. So if you recognize this as a medical crisis, you can call the appropriate medics, we can get the medical intervention, and if appropriate, transport them to the hospital. The main reason that we're seeing this now more than ever has to do with a combination of two things. First of all, stimulant drugs are still out there and their use seems to be rising. Stimulant drugs by themselves in a one-time shot are not going to induce this. This is stimulant drug use over a period of time. We're seeing a lot of cocaine out there, a lot of methamphetamine, and those seem to be the primary culprits. The other factor is mental illness. It can be either stimulant drug, mental illness, or a combination of the two. It used to be that people who had a severe mental illness were institutionalized under the care of a doctor and they were administered their medication at regular doses. As the emphasis in the mental health medication, if they're not taking their medication, they begin self-medicating with stimulant drugs, it's possible that they're going to find themselves in this condition of excited delirium. That means that we as first responders, the police, the firefighters, the emergency medical technicians, are going to be the first point of contact for people in this potentially life-threatening medical crisis. One of the visual aids we're going to use is to show you a video. We commonly refer to this as the barbershop video. In this, we have a person who's in the classic state of excited delirium. Just to set it up, this person's naked, showing signs of hyperthermia, which is elevated body temperature. He's sweating, he's shouting incoherent phrases. Other times you'll see somebody that's making animal noises, known as keening. This person's already been shot by the property owner, so he's got apparent insensitivity to pain. He's not feeling the fact he's been shot. The officer's using a lot of body weight to try and hold this person down, and it's having no apparent effect because he's exhibiting superhuman strength. So somebody who's suffering from excited delirium, you could see extreme agitation, disorientation, or paranoia. You might see hyperthermia, which is overheating, in the form of them sweating, seeking water, or stripping off clothing. Bizarre and or aggressive behavior, shouting of incoherent words or phrases, or keening, which is making animal noises. You may see lid lift, which is the eyes open wide so you can see the whites all the way around. Paranoia, panic, violence towards others, attraction to light or glass. It's not uncommon for somebody to attack the lights of a patrol car or break out glass. Unexpected physical strength, apparent insensitivity to pain, and sudden tranquility is normally a danger sign at the very end. In this video, where we see the man wearing only socks, the things to note are the cooling behavior. He stripped off all of his clothing and is wearing nothing but a pair of socks as he's walking down the street. He has a strong attraction to the lights of the patrol car and in fact chases the patrol car for about 15 minutes. In this third video, you'll see a man standing in the middle of the street. When the officer approaches him, he becomes immediately aggressive, takes a swing at the officer, and he's combative. He then goes on to strip off his clothing, which is a sign of cooling behavior, trying to cool his body down. From there, they deploy the taser up against him at fairly close range. For most of us, that's going to be painful enough to drop us to the ground. In his case, you can see insensitivity to pain as he tries to fight through it. Eventually, he goes to the ground, but he's not impressed by it. He's not feeling the pain, and he's got this superhuman strength as he continues to try and fight through it.
Get on the ground now! Legursky, bring me the taser, 500 block 11. Get on the ground! Get on the ground! Quit fighting! Stop! Lay down! Roll over! Roll over!
When patrol responds to an incident like this, we want you to, first of all, worry about your safety. If you can assess this person from a distance, don't approach until you have enough resources. Get as much backup as you can to approach this person safely. You're not always going to be able to do that. If he's endangering others, you're going to have to go in. The idea is that we want you to use enough control tactics that you bring this person under control as quickly as possible. That way we can get the person restrained and delivered to medical intervention as quickly as possible. Once law enforcement becomes involved, if we have to intervene, we certainly don't want somebody dying in our custody if we can prevent it. We've established a new protocol with the Seattle Fire Department. If we request a medic response for a violent subject, that's supposed to trigger a Code 7 response, meaning they're going to send us the crews to assess the scene, but they're also going to roll medics. Those medics now have an unusual protocol, meaning that they're now allowed to sedate subjects in the field if it's appropriate. That means that in order for them to sedate them, you're going to have to restrain them. They're going to need a limb or something holding still long enough to inject it with the sedative. Once that's done, they're going to assess the person and, if appropriate, transport them up to medical intervention.
Put your hand behind your back. Put your hand behind your back. Put your hand behind your back.
In the context of excited delirium, this period of peril is that moment from the time the person stops struggling for about 5 to 10 minutes afterwards, because that is the time period where their adrenaline levels are falling, potassium levels are potentially rising, and this acid level they have in the bloodstream is especially dangerous to the heart. If they're going to die from this, chances are they're going to die in that very first 5 to 10 minutes after the struggling stops. Normally that's when we as police officers are dusting ourselves off and picking up our equipment, but we need to have somebody specifically monitoring the subject during that time. If you can transfer them to medic care during that period of time, even better, because they're better equipped to monitor the person. The medic response is going to be your judgment call as the officer. If you're out on a Friday or Saturday night and you have normal, typical bar behavior, people who are getting drunk, they're getting rowdy, maybe they're stripping off their clothing, but it's controlled behavior. When you show up, their behavior modifies. That's probably not what we're talking about. We're talking about when you show up and you see somebody who's very aggressive, they're not responding as you would expect. That's the time to begin to suspect perhaps there's something more going on. Perhaps we're seeing an actual medical crisis. If that's the case, call for a medic response for a violent subject, get the medics on scene so that they can evaluate this patient. Well, there are several different ways we can initiate this excited delirium protocol that we talked about. The dispatch center is actually training each of the operators, or they're in the process of training the operators on what to look for and what questions to ask. If they suspect that this may be an excited delirium episode that they're getting calls about, they're going to get a fire operator on the line at the same time so they can ask the medical questions and determine if a joint response with fire is appropriate. If so, they're going to initiate that at the dispatch level, so we'll respond with fire. If, on the other hand, you arrive at a scene and you're seeing things that aren't quite right, that are looking like these videos and sounding like these points that we pointed out to you, go ahead and, from a distance, begin calling for your backup, if you can safely, and go ahead and get fire rolling your way so that they're on scene to sedate if appropriate and give medical treatment if appropriate. If you suspect somebody is suffering from excited delirium, your goal, once you can do it as safely as possible, is to restrain the person with a minimum amount of fight. The more they fight, the greater the chance of a negative outcome. Having said that, one of the quickest ways to restrain somebody who's under the influence of excited delirium is to go ahead and employ a taser. The idea is that while the taser is cycling, have somebody restrain the person and deliver them to medics if the medics are present. We want to reduce the amount of fight possible. When you're restraining the person, think about increasing their ability to breathe. If their bloodstream is acidotic, the only way for them to off-gas that acid is through the exhalation of CO2. So you don't want to do anything that's unnecessary to restrict their breathing. If you suspect that the person you're dealing with is suffering from excited delirium, when you write your paper, please include as many of the excited delirium factors that we've discussed here as possible. The most important one, the key one that's going to help us in determining what type of medical crisis this person was suffering from, is going to be body temperature. The body temperature is one of the key indicators that seems to differentiate excited delirium from other drug-related medical crises. If you can, get the medics to take the temperature. If you have to send somebody to the hospital with them, simply ask for the vital signs. It's not a bad idea to go ahead and document in our paperwork what the blood pressure, temperature, respiration, and heart rate was. But the temperature is the main one we want you to get. If there's nobody there to take the temperature, then describe it. Touch them. Are they hot? Are they sweaty? Are they cold to contact? These are things that can help us later on if the person does die to figure out what was going on with them at the time. In developing this protocol, we've met with Dr. Kopis, and his feelings are that this is actually a medical crisis. If you encounter somebody who's suffering from excited delirium, he would like the opportunity to treat this person. If it goes bad and the person dies, he's much better equipped to articulate what happened to the person and why it happened and why this process actually started long before police ever came into contact with this person. As we've learned more about excited delirium, we're actually recognizing that our officers are encountering it on a more frequent basis. Fortunately, we have a great Medic One system here in our area. That doesn't mean that we're not going to have some bad outcomes if we don't treat these cases appropriately. We need to recognize the signs of excited delirium when we're encountering somebody, and we need to go ahead and activate the medic response to a violent subject if we suspect this is an excited delirium case. If the medics don't feel this is an excited delirium case, wonderful. They've screened it. We can now process them normally just like any other violent individual. But if it is a medical crisis, we've done everything that we can to deliver them to medical intervention, and if they die, it's because of something that happened to them before we encountered them, and we've done everything we could to save their life. The key is that as a police officer arriving there on the scene, you don't know how far along they are. You don't know if death is imminent or if it's still a couple hours away.